Hello guys, welcome back to MEDICO DIY, and today in this video we'll be talking about hypoglycemia. Hypoglycemia, it is a condition in which there is decrease in the blood glucose level. The normal blood glucose level is 70 to 140 milligram per deciliter. But whenever there is a decrease in the blood sugar level, that is the blood sugar level of less than 70 milligram per deciliter or less than 3.9 millimole per liter, it is known as hypoglycemia. The hypoglycemia, it is most commonly seen in diabetic people which are treated with insulin or other anti-diabetic medications like bigonides and sulfonylureas. But if the hypoglycemia, it occurs in non-diabetic individuals, it is known as spontaneous hypoglycemia. The hypoglycemic individuals, these are usually symptomatic at a blood glucose level of less than 40 milligram per deciliter or less than 2.2 millimole per deciliter. Whenever there is a decrease in the blood sugar level in the body, there are various physiological responses which gets activated. The first one being the beta cells are suppressed, that is the insulin secreted by the beta cells are suppressed and the glucagon secreted by the alpha cells are increased. There is also activation of the autonomic nervous system, which releases the catecholamines both systemically and within the tissues. And there is also release of the stress hormones like cortisol and growth hormones are increased in the blood. All these causes the reduced whole body glucose uptake, and there is increase in the hepatic glucose production, which maintains a glucose supply to the brain. The motto of all these steps is to maintain a constant supply of the glucose in the central nervous system. Whenever a person develops hypoglycemia, there are various symptoms which can be categorized into two parts. That is, those symptoms which are related to the activation of the autonomic nervous system and those which are caused due to the decrease in the glucose level in the central nervous system, which is known as neuroglycopenic symptoms. The autonomic nervous system symptoms include sweating, tremors, palpitations, hunger, and anxiety. And those neuroglycopenic symptoms, it includes delirium, drowsiness, speech difficulty, unable to concentrate in anything. There will be incoordination, irritability, anger. Whenever the blood glucose level is low, that is around 20 to 40 milligram per deciliter, the person may develop seizures. And if it is less than 20 milligram per deciliter, then the person may go into coma. The other non-specific symptoms are nausea, tiredness, and headache. The mortality of hypoglycemia is usually 4% in insulin-treated patients. There is also a term known as dead-in-bed syndrome, which are usually seen in individuals with type 1 diabetes. And here, the death occurs due to hypoglycemia-induced cardiac arrhythmias. The hypoglycemia usually occurs in individuals with the use of insulin or anti-diabetic medication like sulfonylureas, bigonides, thiazolidinediones, or the person who has discontinued the use of long-term glucocorticoid therapy or increased alcohol intake, use of beta blockers, quinine, salicylates, and acetaminophen. Talking about the management of hypoglycemia, whenever a person is unconscious or projecting the symptoms of hypoglycemia like restlessness, tremors, palpitation, sweating, then we should measure the blood glucose level, random blood glucose level, to confirm if the patient has hypoglycemia or not. First, we need to maintain the airway breathing and circulation. If the patient is conscious, then we will treat the patient orally by giving them 10 to 15 or 25 grams of glucose in 500 ml of water, or we can also give glucose tablets or fruit juice. And we will measure the glucose level after 15 minutes. If after 15 minutes, if the blood glucose level is still low, then we will repeat 2 or 3 more cycles of the same treatment. If the blood glucose level still remains low, then we can give the person glucagon 0.5 to 1 mg intramuscularly or subcutaneously. If the patient is under long-acting sulfonylureas like glibenclamide, they can have a recurrence of hypoglycemia. Hence, to avoid that, we will be giving them intravenous fluid, that is G10 infusion. But in an unconscious patient, we have to treat them parenterally by giving either 25% dextrose or 10% dextrose, 100 ml or 150 to 200 ml over 15 minutes, and we will measure the blood glucose level after 15 minutes. And if the patient becomes conscious, then we will repeat the same cycle as in conscious patients. Then we will measure the blood glucose level every 4 hourly, and if the symptoms subside, then after 24 hours we can discharge the patient. Whenever the person has hypoglycemia, we always need to find the cause to prevent the recurrence. If the patient they remain unconscious even after the correction of hypoglycemia, then other causes of unconsciousness should be sought out, like alcohol intoxication, post-ictal state, cerebral hemorrhage, and cerebral edema. Now this is a flowchart of hypoglycemia. Whenever a person has hypoglycemia, we need to do resuscitation and initial assessment, maintain the airway, breathing, and circulation. If the patient is conscious, we will be treating them orally and discharge after 24 hours if the patient's symptoms have resolved. If the patient is unconscious, we will treat them parenterally by giving D25 or D10. We will check the GRBS in 15 minutes. If the hypoglycemia is controlled and patient is conscious, we will give them oral glucose drink. If the hypoglycemia is controlled but patient unconscious, we will refer after stabilization in removed areas. And if the patient has hypoglycemia, they persist and the patient is unconscious, then we can give glucagon 0.5 to 1 mg IM or subcut, and we can give hydrocortisone, that is a glucocorticoid, 200 mg IV stat, to increase the blood glucose level. Now spontaneous hypoglycemia, it refers to the hypoglycemia occurring in non-diabetic individuals, and the most common cause of spontaneous hypoglycemia is excessive alcohol intake. In spontaneous hypoglycemia, we need to take care of Whipple's triad, which consists of patient having symptoms of hypoglycemia, low blood glucose level measured at the time of the symptoms, and the symptoms resolved on correction of hypoglycemia. Thank you guys for watching this video. I hope you guys like this video. If you have any suggestions, please feel free to contact me through my email or through the comment section. Thank you guys. Stay tuned for more videos.